Very good afternoon to all of you. On behalf of Sri Lanka Medical Association, I would like to welcome all of you for this very important session. That is our first SLMA 133rd Anniversary Pre-Conference Workshop. We are basically kickstarting the annual academic sessions, the International Anniversary Conference of SLMA, with today's historic pre-conference workshop. And this is a very important pre-conference workshop for us due to many reasons. The first reason is we are celebrating 150 years of medical education in Sri Lanka during this year. And right now we are going through a crucial time period globally as well as nationally. Therefore, a lot of changes in medical education are called for. And we are moving into the new norm. So today, during this very important Dean's Roundtable, we'll be discussing the new norm situation and then planning out how the medical education will be moving towards the new norm, and also the current challenges that we are facing related to the medical education, such as the World Federation of Medical Education decision regarding accreditation of medical schools. So today we'll be discussing all these areas, and I would like to invite my co-host and the co-moderator, Dr. Sajid, to welcome the panel and give an introduction about today's discussion. Over to you, Sajid.
Thank you, sir. Today, we will be talking mainly about the future of the medical education, adapting to new normal situations. So in this panel, we have all the deans of the medical faculties, the state medical faculties. So we warmly welcome all the deans of the medical faculties. By individually, we will introduce and describe each and every dean who has participated for the webinar when we are giving the chance for the speaking time. And the important thing is, and we will also welcome all the participants who have joined us with online for this first pre-congress workshop, the Dean's Roundtable. So in order to start the webinar, Professor Indika, I would like to give the opportunity for you to start the webinar by introducing our first speaker.
Yes, so as we have mentioned previously, this is a very historic event, getting all the deans in Sri Lanka together into one virtual platform, which we call the Dean's Roundtable. So this is going to be a historic meeting with a lot of important areas discussed. And our first speaker is Professor Wajira H.W. Disanayaka, who is a newly elected Dean of the Faculty of Medicine, Colombo. And he has more special reasons to be a resource person for this historic webinar and the pre-conference workshop, because he has special interest about the IT and the medical informatics. And IT and medical informatics would be very important when we are moving towards a new norm. Further, he's a past president of Sri Lanka Medical Association as well. Over to you, Professor Wajira Disanayaka.
President of the Sri Lanka Medical Association, Professor Indika Karunatilaka, co-chair Dr. Sajid Edirisinghe. Thank you very much for inviting me as well as all the other deans to take part in this, as you correctly said, the historic webinar bringing together all deans of medical faculties in the country. I don't think we've had an event like this in the entire history of the Sri Lanka Medical Association. So I would like to begin by congratulating you for taking the initiative and the council for the excellent arrangements that you've put together. As we all know, COVID has been a challenge as well as an unprecedented opportunity. It has created or it has challenged us to think differently, to work differently, and also to reflect on what we are doing in a way which has, all of us have never been challenged before. So the special thing that I've always seen in the COVID epidemic is the fact that as the medical profession, we have had to go back and look at the basics of public health. And it is that strong basics that have on which Sri Lanka's health system is built, that has enabled us to face the COVID epidemic and not be, if I were to use the word, affected to the scale at which even some of the more affluent countries in the world were affected. At the same time, we also have to be cognizant of the fact that if we did not have that strong public health base, and if it was a different scenario of rampant COVID in the country, whether we could have actually dealt with that situation. And so in that context, we really need to look at, okay, what are we doing? How would we have responded differently? Today's discussion obviously is centering around medical education. And as a medical faculty and as a newly elected dean of medical faculty, I have had to reflect on how we respond to this. When we are confronted with a challenge like this, the first and the most paramount important thing is the consideration, I would say, is the safety of everyone. The staff, the students, those who seek our services of a faculty in another way, and so on. So in that context, what we found was that although we had a centrally driven response to how we deal with the security aspects, the safety aspects, there was also the need for everyone to identify what their roles were and then to play that role. So as a faculty, we focused on that. So while we were focusing on the bigger picture of what our response was going to be, we were also focusing on identifying what the role of the individual was and how to ensure that that central guidance was broad enough to enable each individual to play their role. And then there was specific guidance that enabled that. However, as you know, one of the biggest challenges that we face in our country is when we implement certain steps to ensure that there is proper monitoring and evaluation and follow-up. And that is the phase that we are now moving into. And we are hoping that we would be able to ensure that the response that we mounted does not fade away and that it would continue to be strengthened, monitored, evaluated, and taken forward. and that the new norm in our faculty, in the way we respond, we function, is not going to be just going back to where we were before all this happened. Moving on to the functioning of the faculty as well as the medical education aspects. It is very clear that the way forward is through digitalization. So the reactionary response to the crisis was how do we get our teaching learning activities moved on to a digital platform. I think fortunately the guidance coming from the UGC, the immediate availability of Zoom and the likes, and the fact that in the University of Colombo we had a strong network operating center which supported us, enabled us to migrate from the traditional way to the online learning platform very quickly. And if you look at the statistics that's been coming out from the UGC, I think the University of Colombo as a whole has made that transition very well. However, digital transformation is not just moving on from the paper way of doing things to just taking that same content into an online platform. So as I said, the reaction was we took our traditional teaching on to the online platform. And what I've seen over the past few weeks and months, because we've been doing this for the past 2 months at least now or more, it's evolving. It's evolving and becoming better. And as both the staff and the students become familiar with the technology, we are making the technology transfer seamlessly. And more people are becoming comfortable with the online way of teaching and learning. However, just still focusing my discussion on teaching and learning, we haven't been able to make that transition beyond teaching and learning to evaluation. So to enable evaluation also to happen in an online world, we need further refinement of our systems. And I guess to getting onto a fully fledged online platform to enable education, that is the next frontier that we need to deal with. And we are starting the discussions, hopefully in the next coming weeks and months, on how we make that transition. However, now I do not think as a faculty we can just focus on only the teaching and learning. There is an entire way of functioning of a medical school. So to enable that, what we did in the Colombo Medical Faculty was we brought in all the groups that were involved in some form of contribution to our learning, teaching learning environment as well as beyond. So again, expanding that teaching learning environment a little bit, we realized that we need to bring in the library. We need to bring in our so-called computer-assisted learning labs or virtual environment, as we were calling it. Then we had simulation labs. Then we have our audiovisual units and so on. So we needed to expand who the stakeholders were beyond the managers of the learning management system, so that now we could deploy these other assets, if you want to call it, to support the lecturers, the professors, and the senior professors and senior lecturers and so on, to create content that was going to be suitable to be deployed on an online platform. So that is what we are doing now. We have set up a group which we have titled as a Center for Digital Transformation, which is looking at this entire effort holistically. Going beyond that boundary also, we realize that we need to bring in also the administrative structures onto the online platform. So how do we transform the administration? How do you transform financial management? How do you transform grant management? How do you transform other aspects of running the faculty? So that entire process needs to be done. And we've now developed a plan which is enabling us to do it. We did a quick development of that plan during the past 1 week. And now we are ready to deploy it in a complete holistic manner. Now, once you have that plan, we also need to realize that there are 2 or 3 other aspects that we need to look into. One is the human resources. So we need to take stock of our human resources and look at how we upgrade the skills of those human resources to enable what we want to do. So that is another aspect that we are looking at. What is the training that is required at all levels of staff? How do we get our non-academic staff also engaged in this effort? What is the training required for them, and so on? The second thing that we need to look at is the material or the resources. So we are looking at everything from IT resources, in terms of computer hardware, network connectivity, connectivity for our students, the connectivity for our staff, then the fact that a simple thing, for example, a staff member in the non-academic staff has to be allowed to take a laptop computer home and operate from home. These kind of aspects of the resource management. And then finally, we also have to look at what are the financial resources that are required to enable this whole thing. What are the finances required to enable this whole thing? So we are in the process of getting that also sorted out so that we will go forward. Then the next aspect is, who are the partners that we need in this process? We need technology partners. So we have now started talking to the technology providers out there who can help us with the infrastructure as well as with the connectivity. We also need to engage with other partners who will be able to enable us to transform the way we develop content for a digital world. We've started engaging them as well. So like this, we are looking at a complete holistic transformation of what we are doing in the faculty. And since we are part of a national system of medical faculties, almost a dozen of them now, we'll be happy to share what we develop here with everybody. as well as we'll be happy to learn from what others are doing. So my final few words is that we are all in this together. We have to respond to this together and overcome the challenges together. And I look forward to working with all of you, myself as the Dean, and I'm sure all my faculty and entire faculty look forward to working with all of you to respond to this challenge. And it would be a pleasure for us to share our learnings and whatever we develop here with all of you freely, as well as learn from you and try to see how we can adopt your best practices to improve what we are doing here as well. So with those words, thank you very much. And I'll hand back to the chair.
Thank you, Professor Vajra Disanayake. You have provided a very elaborate overview about a master plan regarding how we can move forward. Before we move into the next speaker, can I ask one question from you? Now, when you think about medical education, a key component is clinical training. Now, most faculty have started the theoretical teaching and even the group discussions. But the key component of clinical teaching and then the practical and maybe community teaching, what are the plans that you have in mind using the new technology without minimizing the current advantages that we have, that is basically the patient base that we have and the clinical material. So how can we move forward related to clinical teaching? How can we move into the new norm without compromising the clinical training of our students?
Yes, I think, Indika, you brought up a very important aspect. I think the strength of the training that we provide in all our faculties is the fact that there is hands-on training and the clinical material that is available in our wards and how people respond. I mean, the fact that our students have free access to this material. So I think the key issue here is how do you avoid overcrowding in wards? How do you avoid overcrowding during a clinical teaching session? And so on. So the clinical departments in our faculty have been addressing this issue, and they have come up with innovative plans of how they are going to do it. So the key lies in the fact that the big ward classes, as it were, is not going to be the new norm. It's going to be small groups working with individual clinicians so that the hands-on clinical exposure is not compromised. But using technology to bring on the bigger learning experience, the traditional classes as it were, and so on. And also that gives you an opportunity when you go, so that the bigger teaching to happen using virtual platforms, online platforms. And that gives you opportunity also, because it is just not only that patient that you would be examining in a traditional class who is presented, but you may have other material which you can bring in to a ward discussion class online. And that could include, for example, small videos that are relevant to a teaching learning session and other material of that nature. So that is why I said we have to look at this thing holistically, because if our digital transformation is just giving connectivity, just you know, without face-to-face interaction, just giving, you know, online connectivity between A and B, that is not a complete transformation. The transformation has to involve bringing in, creating the platform to bring in other material that would be useful and are relevant to a particular teaching learning activity. So that is what we are looking at. How do you make that transition so that everything is provided in this platform and it becomes a kind of a enhanced experience. It has virtual reality coming in, it has interactive videos coming in, it may even have interactive question and answer sessions coming in, and so on. So we need to ensure that that entire transformation has happened, and that is what we are looking at.
Thank you, Professor Ajira. Maybe perhaps there may be blessings in disguise, and perhaps we can improve the student engagement, and maybe making the clinical teaching sessions more engaging and interactive using the current opportunities that we have. And next, we'll move to the next speaker. I would like to invite Dr. Sajid, my co-host, to invite the next speaker.
Right. Thank you, sir. Our next speaker will be Professor Surangi Asawardana, Dean, Faculty of Medical Sciences, University of Sri Jawatanapura. Over to you, madam.
Thank you, Sajid. And also thank you very much, Indika, for giving this opportunity, and a very timely topic where we should, all the deans and everybody should be discussing. So I think the background was very well given by the former speaker, Professor Vajira Disanayaka. So I will proceed from that point. I think the main challenge for us as deans is already the medical course is quite a long course. So with the previous 1 or 2 years, we all know with the strikes and things, it has now a time that the student spends in the faculty is about 6 years. So our main objective should be to somehow, with this COVID problems coming on, somehow reduce the whatever the rest of the, we have to catch up the time that we have lost on this due to the COVID situation. So in that regard, I think in all the medical faculties, I'm aware that as Professor Vajira very correctly explained, we have been going on to the web-based platform, and a lot of online teaching, theory teaching has been done. So with that, I think little later we had this problem. We thought of that somehow only the theory teaching would not be sufficient. So we have to reduce our whatever the time on practicals and other clinical teaching. So with that idea, I think we went on to the stage where certain practicals were like the actual sessions were videoed, or like we had the real the method how to do a practical and that was uploaded to the LMS. So that was initially delivered to the students. So our idea was that the students are well aware about the how to conduct a practical. If I take my discipline, anatomy, where in fact we went to the extent of showing them the dissections, where we did the dissections and what are the structures they have to identify, so that when they are brought to the dissecting room little later, they are well aware what they have to do, so that the practical we can really catch up on time. So that was one thing that we really, the staff worked during these days, and that is happening at present. So the practicals, what we are going to do in future is to actually combine, maybe where previously we had 1 or 2 practical sessions will be combined, and the students, when they return to the faculty, they will do the practical in a lesser time period in so that we can reduce the time that they spend in the faculty, because as we all are aware, the main issue, the challenge that we have is that with our hostel facilities and the facilities available in the university, even after, the situation in the country improves, when they return to the faculty, we have to reduce their stay in the faculty. So with that sense, we have been going into the extent of even doing the practicals, showing the practicals to the students. The same thing would apply if I am to answer the question that Professor Indika raised previously. Now, once the hospitals open up and when the students are there to do their clinicals, I think the situation will be quite different. It will not be the same situation, whereas the medical students should walk into the hospital wards or the professorial units at any time and approach any patient and ask, get the history and examine. So with that, I think we have to adapt during these days with the base teaching. Maybe that we can, like even the patient, and we can get a demonstrator or another one student to question the patient, and that could be through Zoom, or give the students to, like, they can again ask questions, seeing the patient, and something like that, where we do even the clinical teaching is being done. That is, I think, happening in professorial units at the moment. So that they are, although they are at home, the students, although they cannot come to the hospital and take a history, they are given as small groups, they are given chance to follow the history taking or the examination, and even ask a question from the patient, so that chance is given. So that sort of techniques, I think we will have to adapt to so that the students at the moment, they have some clinical exposure, so that we have to maintain that is one thing. And the next is actually during this period, what we have adapted in the faculty, something that the students have to be in their good mental frame. So the mindfulness program that has been running in the faculty, where a lot of student participation, so that they are in good mental frame. So with all this, where the country is having this troublesome situation. So with that, that is also happening. So, again, Professor Vajira very correctly said that what up to now, what we have not been doing through web-based is, actually we have not done the assessment. That is also some sort of formative assessments, like the assignments, where they have been given through the LMS, they have been given the chance, the questions, tutorial questions, where they answer and submit. That is also happening. But the formative, I would say the summative assignments, up to now, we have not done. So as we all know, that next Monday we're having the final MBBS examination. So that is being planned. I think that is what has been happening at the moment in the faculty, and very correctly, this has been a new experience to both the teachers as well as to the students, and I'm happy to say the students are very, very happy in this setup, and they have very easily, more than the teachers, very easily the students have adapted with the new web-based teaching, and where the teachers are also doing that. Thank you, Indika.
Thank you, Professor Rangi. I would like to ask a different question from you, because I think you are the senior most or the long-standing dean in the medical council during last so many years. As you are well aware, there was a decision from the World Federation of Medical Education regarding accreditation. And if the medical school accreditation in Sri Lanka, if it is not in confirmation with the World Federation of Medical Education, there is a risk that we might be losing the current situation or the current recognition with the ECFMG and probably the World Federation. And that is not applicable only to Sri Lanka, but worldwide as well. And recently, considering the current COVID situation, the WFME has relaxed the deadline on 2023. And the current situation, Sri Lanka, the minimum standards medical education is yet to be approved by the parliament. And that would have a lot of implications in medical education and the standards as well. So what is your opinion? How can we get the minimum standards in medical education, probably an accreditation system? What's your vision and thinking regarding that?
Actually, with regard to the minimum standards, I think the minimum standards are very good document has been prepared with the participation of all the medical faculties. In fact, the minimum standards document was sent to all the medical faculties. It was discussed in all the faculty boards, and with all that was handed over to the Minister of Health, to the Sri Lanka Medical Council. And as very correctly you mentioned that it has been actually the gazette is prepared, but the thing is it has not been discussed at the parliament. So the thing is it need to be somehow, I think, as deans and as from the Sri Lanka Medical Association, and I think even the everybody, all the medical educationists, we should be pressing the health minister somehow to take this to the parliament, and where I think this need to be discussed at the parliament so that it becomes it is gazetted. The thing is, the parliament, first of all, I think the parliament should be functioning. So the next is the major issue. Now that anyway the minimum standards, all of us have agreed on the minimum standards. So now the next is, as you said, about the WFME and the recognition. So here the medical course, it's a professional course, and at the UGC we do have the quality assurance and quality assurance unit where all our medical programs have been assessed, but that is different. Since this is a professional course, I think the professional accreditation should come from the Sri Lanka Medical Council. So this has been discussed at the Medical Council, and in fact there was a small subcommittee appointed, and we have gone into that, and now I think we should be applying to passing this to the World Federation, so that we should get the Sri Lanka Medical Council as the professional body. Whereas then the next is the Medical Council will have to go through the medical programs in the country and do the accreditation. And because I think Professor Indika is well aware that we have to have this one round of accreditation should go, so that the WFME will take us seriously, and I think they would recognize Medical Council as an accreditation body. I think that is very, very important. We all should realize the importance of that and somehow go through this cycle quite early.
Thank you, Professor Angi. Actually, there was the meeting regarding this accreditation during last year, 2019, before the COVID came in. And the ECFMG and the WFME, they have expressed their willingness to work with Sri Lanka. So this could be one very important topic that all the deans should take note of and work together, because we need to establish an accreditation system. And thank you so much. And we'll be moving to the next resource person, Professor Prasantha Vijayasinghe, again a very experienced academic and a clinician, and who has a lot of experience at work in the PGIM as well. Professor Prasantha, is over to you.
Thank you, Indika, for allowing me this opportunity. Historically, during my professional life, which spans over more than 4 decades now, words like distance learning mode, LMS, computer-assisted learning, these were being discussed over the last several decades. But how much of that was incorporated in our teaching learning culture was at best sporadic. So that was the past. So as Indika mentioned a while ago, that the COVID-19 is a blessing in disguise. Now the time has come and all of us have to latch on to this mode of teaching learning, which is one of the few that is available because of this pandemic. And of course, I see few challenges with regard. There is a need to empower the teachers because not all teachers are conversant with the technology. They may not be conversant with the possible teaching learning tools that can be used in this endeavor. Then of course the students, now I get reports from some students, some students are lacking basic facilities like electricity, internet coverage, the proper bandwidth. Some people don't have the equipment necessary, so on and so forth. And of course the environment, the administrators, the computer centers, the other people who are supporting this activity, even the mindset among some of these people will have to be adjusted to this new situation. The challenges that I see for the future is probably the knowledge aspect. Probably we can impart knowledge through these distant learning mode fairly effectively. But when it comes to developing skills, be it skills that has to be developed in a laboratory, maybe in the community, or maybe in the clinical setting, that probably will be a bigger challenge. So obviously there is innovation that is required in order to use different techniques to impart skills on our graduates. And of course, another aspect is the attitude and the mindset of graduates. So something that we will have to think about if we were to live with this new challenge where distance learning mode will become a way of life for all the stakeholders. So that is my small message to everybody who is joining. Thank you very much for giving that opportunity. Thank you.
Thank you, Professor Prasant. And with your long-standing administrative experience, you have highlighted the need to be practical and to think about the available resources and what are the challenges that we have. And because for the interest of the time, we'll move to the next presenter. Again, Dr. Sajid.
Thank you, sir. The next presenter is Professor Asiri Abe Gunawardana, Dean, Faculty of Medicine, University of Peradeniya. Over to you, sir.
Right.
Professor Asiri.
Thank you very much, Indika and Sajid. Actually, this is a very timely discussion because I think the medical education is really facing a major challenge. On one side, we have been asked to increase the intake, and at the same time, now we are facing this challenge of COVID, as well as at the same time, there are other constraints, physical constraints, as well as clinical materials in medical education that probably needs to be addressed. In a medical faculty, we need to impart knowledge to candidates, the students. At the same time, we need to equip them with certain skills, as well as we need to conduct assessments to make sure that we have done our job. Now, imparting knowledge can be done with lectures, small group discussions, dissections, and practicals. Now, all these things is not going to be a major challenge in spite of the COVID epidemic or with constraints of other things, because the online platforms has really worked very well. So I don't think we will have a major challenge in that. But the major problem will lie with the clinical training and clinical examinations. So the clinical training in our medical faculties usually commences from third year onwards and spans over 3 years or so. And most of our clinical training is counted in weeks. Now, even the medical minimum standard documents, we have counted things in weeks. Now, what we are actually doing in medical faculties is forced teaching. I mean, we say, okay, you have to go for 2 weeks appointment for ENT, eye, etc. Whether we are actually getting what we need for medical education is something highly questionable, because we are actually using less than 25% of the total capacity of teaching clinical training facilities, because we are using only the main big teaching hospitals. Now, if you look at very advanced medical faculties like Cambridge University or Yale University, now there they provide you a task. So for example, you have to go and follow up a mother who comes with a pregnancy until the delivery and for the first 2 weeks afterwards. So that student will go they have this designated areas, the hospitals to go, so they can just simply go and follow it up and the task is done. But in our setup, sometimes they do clock about 25 patients, but they never follow up from A to Z. So, so we will have to learn new methods. So by using the required skills, how to equip them by sending them to various places. So they can effectively do in their local hospitals. So some clinical skills can be obtained. I mean, suturing can be learned even at a base hospital surgeon. So if we sort of effectively communicate with these clinicians in and around your area and utilize them to the maximum, then we should be able to overcome this. So, but we will have to think innovatively and reform our clinical training program entirely. In addition, the conduct of examinations. Now we actually faced with that today when we are conducting the final examination. Now, even without the COVID epidemic, the number of cases available for or to conduct examination is fast declining, and we are struggling with the numbers today. So we need to think of using simulated patients and also assessing real skills by using now finding clinical signs is only one aspect of clinical examination, but there is an approach, the technique, the communication, all that. So we may have to sort of think differently. So these are the challenges that we are facing today, and I'm sure we have solutions for that. So it's very good that you had this webinar with all the deans on the platform, so that it has opened up a discussion so that we can take it forward, because if we don't do that, it will be a very difficult task for us, because as Professor Surangi mentioned, our course is really packed with material, and because of these interruptions, it has got extended beyond 6 years. So we need to cut it down to 5 years, because holding 6 batches in medical faculty is always a burden to any medical faculty. So we have to sort of see that we some other get back to 5 years, and that 5 years too, in all our assessments that we have done, the students are highly stressed, and so many students have gone for treatment for depression and stress related disorders, and I do know sometimes they even attempt to commit suicide as well. So we have to look at that side as well. And as Surangi said, the students are really enjoying the online teaching program. So because they are of different timeline, we are different timeline, so they are more familiar with the digital learning and digital technology, and I think we need to cater for that. So this COVID thing came as a blessing in disguise for medical education in Sri Lanka. Thank you very much, Indika and Sajid.
Thank you, sir. Before moving on to the next speaker, I just want to ask a small question from you, sir. So according to your view, what could be the percentage like the lectures, how much of percentage that we can deliver online? I know that all the lectures cannot be delivered online. So according to your view, what could be the percentage like?
At least 50% could be delivered online, maybe even more. But certainly certain interactions are necessary through live lectures as well, because then there is some sort of interaction between the lecturer and the students. So certain things you really need to have live platform, but most of the things, the knowledge can be easily delivered through online lectures.
Thank you, sir. To introduce the next speaker, I would like to hand over to Professor Indika. Over to you, sir.
Thank you, Sajid. Before moving, maybe if I may ask one more question from Professor Asiri, the Dean Faculty of Medicine, Peradeniya, because Peradeniya, as you know, has been a pioneer in medical education since Professor Seneka Bibile's time, and a lot of innovations in medical education started there. So what do you think about making this as an opportunity to introduce new innovations in medical education, probably with the support of the medical education unit at Peradeniya?
I think the medical education unit has been leading our online teaching program, and I'm very proud to say that it has been a great success. And it was a privilege to have that unit in our faculty, and especially Professor Kosalamarambe and Dr. Sisira Dharmaratna has been a real strength in that. So I think the medical education needs to change now, and I'm sure you all can contribute for that.
Thank you, Professor Asiri Abhegnawarthana. Now we are moving to a brand new medical school, that is the Sabaragama University, one of the university in Sri Lanka, and Professor Nirmali Vikramaratne is the current dean of the faculty. And Professor Nirmali, would you like to discuss about the challenges that you face as a new medical school and how you are facing them and overcoming them? Professor Nirmali, over to you.
Yes, thank you, Professor Indika Karunathilaka and the President's Sri Lanka Medical Association and Dr. Sajid Edrisinghe for inviting me to deliver these challenges that we are facing today as a new faculty of medicine. And I should start with saying we are the youngest faculty of medicine for the chain of medical faculties of the Sri Lankan state medical universities. So one thing, we are privileged to have it. And also to start with, I have to say thank you to all the rest of the deans of all the medical faculties, because they have supported us tremendously to come up with this. So at present, we have only the preclinical departments functioning. And it was inaugurally opened only in last year, 2019. We accepted our first batch. Just to give you a briefing of the medical faculty, we accepted 70 students as the first batch, and 75 students, 2020, January, we accepted as our second batch. So at this moment, we are in the process of recruiting staff members for the paraclinical departments. And so you understand that we are only at the preclinical stage of where the program is concerned. So this situation was not ever expected, I think, by most of the academics. And it was a big challenge to go into a virtual mode of teaching. So I have to thank my staff members, who are very young. And although they were young, they were very happy to take up the challenge, and they were all willing to go online for teaching. And however, we had so many challenges, because if you know, our university alone is also a very young university. So getting into the system, setting up the LMS for the faculty, then opening up the space, the amount of the space that they allow us to upload the data was very limited. So we had to go on improving this time to time, and we had to have so much of discussion. So we had to go on improving this. So one thing that most of the speakers mentioned it before also, like apart from the physical, we had to improve the physical resources as well as the human resources. So human resources were very, very good, and they went on their own ways, and they found a lot of things that what we could be doing online and to be very interactive. So developing physical resources and human resources was a challenge. And then again, it was also mentioned that most of our students who are coming from some remote areas are facing the difficulty of actually getting access because they don't have this data facilities. So I think the standing committee also is trying to resolve that issue, talking to the data providers to increase the strength of the signals so that they can access. So these were some things that Sri Lanka was not prepared for. Not only the medical faculty, the whole system, the Sri Lanka was not prepared to face such systems. So unlike other universities in the other part of the world, it was very difficult for us to get into it. Even as of today, some students are facing difficulties. So even with those difficulties, I had to thank the medical students also. However, they are still continuing. They're managing themselves to get in and log in and share the information that we provide them as to continue their education. So just to brief you what we have been doing at Sabaragama University, my Faculty of Medicine is, I'm sure this is what all the other faculties also do. So we are actually a very young university, so you can help us out in any other special modes that you have. So we do PowerPoint presentations in voice and upload to the LMS, and then through Zoom, we do the lecturing. And there we find the students to be very interactive. We also do the practicals, and then SEQs, and then we give students tasks online that they have to submit every week. So regular discussions are being taken place, small group discussions, peer group discussions. We upload SAQs and even essay questions. We give them tutorials, we mark them, and we get them down. And even the laboratory classes, we are trying to do as maximum as possible. So these are, our staff members prefer to go with Google Classroom, which is very interactive. So these are some things I'm showing you that here our staff has done Google Classroom evaluations. So which is easy that they get the evaluations, the number of people who have submitted, and then the marks, everything can be tabulated easily. Then these are some programs that our Department of Anatomy has been using. Just like the anatomy department always say that is the most tedious section to be taught, I think they are the people who had most of the resources already available online for them to use. So they had a lot of resources. So these are some of the resources that they have been using. And some of these are free, and some of these we had to pay. And these were sent to us by the students saying this is how they do some mobile apps used by students for their self-learning. So for histology, they do the blue histology. This is how they do the slides, descriptions of slides and stuff for the students. And for the practical sessions in biochemistry and physiology in both, that we upload the videos or video demonstrations for the students. And prior to along with that, we do the pre-lab for the students through Zoom and LMS. And the students have to submit a report on what they see, and that is being corrected, graded, and returned to the students. Also, we give MCQs, and Zoom meetings are done to do their questions, answering their questions regarding the practicals. So this is one of the examples that the students have submitted their reports. So this is also some examples of Zoom meetings that we had with the students. So the students have been very good and very interactive. They come up with their questions, and the lecturers and the demonstrators in charge do provide immediate solutions to them online. So this is another example of a clarification that is provided on a practical. So, however, we think there are limitations and there are certain things that they should have hands-on experience. So that is limited during this virtual teaching. So when they come back, however, we think we could give them their hands-on experience in a very short period of time. And we expect to finish most of the lectures online, because preclinical lectures, I think 100% the lectures can be covered through online. But like what it was said, so it's a teaching and learning process. So we have to do continuous evaluations to see how much they have learned. And also with our own experience, we know when it's a classroom session, it's more interactive and we can immediately evaluate how much they get in. So that aspect is missing in this way. So if we can develop certain measures to develop such evaluation methods to ensure that students grab whatever we teach. But again, I think this is a very good challenge for the students because university education is not spoon feeding, and it's the responsibility of the student to learn on their own. Self-learning should be encouraged. And so this challenge is not only for the staff members to upload their information in an interactive manner so the students can do their self-learning, but it's also a challenge for the students to improve themselves. And this would be helping them to improve their critical and analytical thinking, because they would have to do their own self-study and go on improving and improving. So throughout, so they would ultimately would think into a certain case, if more critically, and they would be able to resolve or provide solutions in a better practical manner. So this is what we are at Sabaragam University, and we already think there are so many aspects that we can, ways that we can improve. We can get the whiteboard, interactive whiteboards, and pooling of meetings. So there are other things that my staff has brought up, like to buy them certain software programs. And also I'm trying to get our computer staff to come and assist us to have these online evaluation methods. So that's what we are at Sabaragama University today.
Yeah, I think.
Thank you.
Yes, thank you. And I think quite impressive as a young university, what you have done and related to the current situation, the challenges, and maybe probably there is an advantage in coming new also, because then you can start on your own with a lot of innovations. And another important point that you brought up is that if we can help each other, Sri Lankan universities, they have their strong areas and the strength areas, and if they can help each other, that would also help us to improve our medical education. So thank you very much, and we'll move to the next presentation.
Thank you, sir. Our next speaker is Dr. Raviraj, the Dean, Faculty of Medicine, University of Jaffna. Over to you, sir.
Problem is, first of all, thank you very much, Indika and Sajid. You made a lot of effort and organized this meeting with our colleague deans. I feel the important thing, first of all, we are against for the corona, but I am thankful to corona. We all now think about, after this corona incident, COVID incident, we are thinking about the electronic teaching, upgrading our, that is a good thing and good improvement. Even so many bad things by the COVID, but this is a good thing because all the university deans and teachers, academic staffs are very keen on now we are upgrading the electronic system of teaching. And I have found in my faculty the last couple of months, most of the students they are very happy about, as our deans earlier, the deans, my colleague deans told, they are very happy about the electronic teaching, first of all. And the other thing I like to suggest, we have to continue, not for a temporary, as a temporary teaching, but we have to continue certain percentage in future. My suggestion is at least the preclinical and the paraclinical teaching, that I mean up to 4th year, most of the lectures and the tutorials can be conducted through the either Zoom or LMS or Google method, whatever the method we adapt is up to our university, but we can continue our teaching. I will say roughly about 60% we can go up to the electronic teaching. But at the same time, face-to-face teaching is very important, especially in the clinical scenarios. That also we can't forget, because that is the best method for the teaching of the clinical things. But even in the clinical section, we are able to teach, such as mentioned earlier, our Prof. Hasri and Prof. Suranki, we can conduct certain amount of clinical approach also, like a program-based learning, or some case scenario discussion, or like a symposium we can organize by the electronic medium. At the same time, clinical teaching, I feel, my opinion is roughly about 25 to 30% only we can able to do by the electronic medium, but the rest of the thing is by the clinical practice. That's very important, clinical practice, because they are going to become a doctors and they have to move with the patients. The patient-doctor relationship, communication skill, practical skills has to be, we have to adapt through our clinical teaching. And if you consider the other things, the UGC and Ministry of Higher Education have to give priority now to upgrade our electronic method of teaching for the students as well as staffs. And other few things in future, one of the set up an example, I think we are going to start the exam for the final years on Monday, 15th. And it's a good trial for us to see what we can do in future. Even other, my suggestion is we can go on other bottleneck exams. It be discussed in the UGC standing committee also. For an example, depend on the university, what batches are having the bottleneck exam. For an example, if in our faculty, the batch before 40th, but that is in the phase 1, having the exam, expected to have the exam in August. Then we can fix like that and we can accelerate our programs. And more than that, I think most of our previous deans have discussed most of the things. And regarding other issues, we had some workshops for our academic staff regarding on the Zoom and Google approach or LMS method. Some of them are not familiar, very few, but most of them are very, they are very familiar to this type of teaching. I hope we have to give now, the time is the priority to electronic method of teaching. At the same time, we have to see that clinical teaching should be continued once the situation improves. That's all I can say. Thank you very much.
Thank you, sir. We'll move on to the next speaker with the time. The next speaker, I would like to hand over to Professor Indika to introduce the next speaker.
Yes, we are moving to another special university in Sri Lanka, because the Eastern University again started at the very beginning. Also, the Eastern University have been using distance learning very much and very prominently in their learning program. I would like to invite the Dean of the Eastern University, Dr. Angela Ulpakasam. Dr. Angela, over to you.
Yeah, thank you very much, Professor Indika. Good afternoon to you, and good afternoon, Dr. Sajid, the fellow deans, and all participants. So I just thought I'll use a presentation. So future of medical education, adapting to new norms. So as thank you very much, Professor Indika, for saying that we are a special university or special medical faculty. I'm really honored to hear that from you. So just a word of the mission of our faculty. Our mission is to produce men and women of high standards in the practice and delivery of healthcare. So now our thinking or our challenge today is, can we achieve standards, this high standard? Can we impart the high standard to our students in the current situation? Well, just offhand, I can say, yes, we can do that, and we'll see why. Now, our faculty started in by a Gazette notification in 2005 with 6 departments. And this again has been a challenge to us from many sides, asking why 6 departments, why not 16? So we find this quite accommodative and supportive to our curriculum. And we had the first batch of students in 2006, and they passed out in 2012. And up to now, we have had 7 batches of medical graduates. And many of them, up to 30 or more, even more, have completed their PG, MG training, MD training, and they are waiting a board certification. And they have gone to various fields of medicine, like medicine, surgery, and subspecialties as well. And a few of them have just started going abroad. So one of the first batch student has ended up in USA, and she's doing quite well, and we get very good reports of her. And some of them, 3 of them exactly, have joined as lecturers. And unfortunately, we have had dropouts also, just 2 of them. But I guess that that cannot be helped. Right? So we tried our best to keep them, but couldn't. And a little bit about the medical MBBS program of FHCS. We started with a unique curricular concept and structure. This is because of the involvement of leading medical educationists at that time, Professor Varagunam, and others like Professor Gunananda, Mahesaran, and other educationists. And we follow the SPICES model, where the teaching or the learning is mainly student-centered, problem-based, integrated, community-based, with electives, and has a systematic approach. So this is the model proposed by Harden. So here our program, as in other programs, consists of 3 phases, and each phase is composed of integrated modules, where as opposed to distinct disciplines. So each module will have contribution from various disciplines, and therefore a single group of lecturers may not be enough. Right? So we were sort of one of the first schools to adapt this, and I know now many schools are following this model. And there is an assessment held at the end of each module, and the feedbacks are given. And this is again a little bit of challenge, whether it's a formative or summative. Now currently it has been an issue for us, because now we want to have this online assessments, and we are not very experienced in this. Do we get these assessment marks, and so on. And then, of course, we have this early exposure to clinical and community field, and we use a GPS system. So that's just a general introduction to the program we are following. Yes, in general, also we face a lot of challenges, right, as opposed to current problems. So the general problems, or the problems we faced earlier, are of course the physical resources. And we have been here for more than 14 years. But we are still at a temporary building. So our lecture halls have limited capacity, and even now parents call and tell, why are you taking only 80 students? Our children are waiting outside, make it 120. But we simply cannot do it at this point because our lecture halls are small. But however, next year things will change. We are getting a new building complex with large lecture halls and state-of-the-art teaching equipment. Then, of course, the inability to recruit qualified professionals, and especially medical professionals with MBBS degrees, quite a problem. This is not only due to the geographical situation where we are, which is a disadvantage, also the monetary aspects. I'm sure all of you all will understand and agree with me. And not only that, the non-academic cadre is also very difficult to fill. Now, what are the new challenges we are facing? Accommodation. Now, accommodation actually is a very good, we do have like, at the current position, we are not overcrowded. We are able to accommodate all the students, and we are getting 2 more hostels as well. And we are now, according to the new problems which we face, our microbiology, our lecturer and microbiologist has given us some guidelines. And so therefore we are trying to follow that, like accommodating 1 or 2 students per room and so on. Currently, it's not a problem. As soon as they start coming, we will face that. The cafeteria, right? How are they going to sit and eat? Do we have enough space to maintain a social distancing when they're eating? What about the extracurricular activities? We are trying to produce a holistic individual, not an academic or just a person with knowledge. So how do we develop these things? And of course, the clinical appointments. So we want to avoid crowding of the wards and clinics, and continuation of the online teaching. So even once we start the university, open up the faculties, then we need to continue the online aspect as well. So do we have adequate connectivity and data? So all our students are very good. They never complain. If data is not, if connectivity is not in their area, they are very good. They are good enough to move to another town or a nearby town and get it. So that's what they tell me. So they never say, please, madam, we don't have data. Please don't do this. They always say, please do it. We will find data anyway, right? And once we start, then we do have to have face-to-face sessions as well. So we have to limit the number. How do we limit the numbers in the classroom? So that's another challenge. Then, of course, again, I'm coming back to the other aspect of student life: sports, social events, talent shows. All these are integral part of the faculty life. How are we going to accommodate all these things? Right. Thank you. So next, yeah. So what are the steps we have taken? So the universal or the standard precautions which we have been advised, we are following, right? So some of them we have already established, like hand washing facilities almost at every entrance in the hospital or the faculty. The hostels, we have, the university was good enough to establish for us. Then we have thought that we will have to break the clinical groups into small, which we are working on it for the not the final years, the final years as well. And then to give them chances, like alternating them from morning and afternoon. So the challenge here is somebody has to be with them to guide them, right? They can't just go and learn on their own. But whatever said and done, students do learn by themselves more than what we teach, but still we have to break the groups into 2 and have morning and afternoon sessions to limit the numbers in the ward. Then in the non-clinical subjects, we have to go more for the small group discussions and PBLs. So for that, we need more space. As I told you earlier, we are already short of space. So how are you going to do this? So thing was suggested, maybe we should put some temporary huts or something where we can accommodate smaller groups of students to conduct these. And to establish spaces, to introduce this, and to motivate the staff to do this. Now, all this time, it was very difficult for us to motivate the staff to go for PBLs. But as Professor Asari said, it's a blessing in disguise. Now we are forced to go and participate in these things, right? And the library, we have opened the library with precautions. We have had, we have a washing facilities, sanitizing facilities, and the librarians are very supportive to allow the students to sit in a social distancing. And again, extracurricular activities, I'm again and again mentioning this. We have some student clubs. We are promoting these student clubs and student activities because we want them to develop their, not only their knowledge, but their whole personality. So already they are involved. So we are in contact with them. So we are also, the staff is also involved in their groups, and they are very good. They are already producing short films and videos in a remote manner, which is new to us because we are from a different generation, and they would call us bloomers or some sort of name they have for us, I guess. But these students, this younger generation, they are very creative, and they have already, many of them are involved in these type of activities. So I guess that will continue. Then mentoring. So as somebody mentioned, the students are depressed. So we always encourage our staff members. Already there are mentors. So they are in contact with their students. They are mentees. So we give them some psychological support. So every day, like almost every day or once in 2 or 3 days, I get message, Madam, when will it start, like that. So when we speak to them and when we reassure them, they are happy. And I'm surprised to see many of the students have already come to Batiklu, and they are living in and around. Like they don't want to stay at home. They feel better here. And Eastern University also has started sort of an online yoga for staff and students, which I have not participated, but I hear it is very good. So those are the things to support the students, which are being, some of them we have to do in future, and some are already in practice. Right, and what are the advantages gained by this COVID pandemic, the newly emerging problems, right? So as someone said, it is a blessing in disguise in some ways. Staff are turning to technology. Earlier, we used to arrange workshops for LMS, and only 1 or 2 turn up, and they're also very reluctant to use it. Now, everyone is troubling the resource people. How do I do this? So they are going after the people who know it, and they are trying to follow it. So it's a good thing. And we have more access to remote teachers now. We don't have to arrange the transport. We don't have to, now it is not expected. Earlier it was expected that lecturer should come. Now it's fine. So even from Peradeniya, the forensic people, Professor Dinesh and all, they are very happy to teach our students in a remote way, over the video. And so we have a wide variety, a spectrum of people whom we can utilize. So that is a very good thing. And we have to look into the possibility of online exams. Now, as we said, we belong to a different generation. We don't like it. We look at it in a sort of a skeptical way. Suspicious. Students will look at the book. Students will go to the internet and answer. But as someone earlier mentioned, it is quite a standard thing in the established worldwide universities. So we too should look into the possibility of these online assessments and take the marks officially, right? Not only just practice it, but we have to take it very seriously. And of course, the environment has changed into a changed to a very favorable environment for self-directed learning. For example, now when we break the groups and send them in the morning and afternoon and all, students are forced to learn by themselves, right? So I think it is a good thing. Now we don't have didactic lectures or ward classes where I make them sit and listen to what I say. Now they are more in by themselves. So that I think that is a good thing. Even though now we don't have clinicals, I get all of us, all of the clinical sciences department, we are conducting our lectures and having discussions over WhatsApp and other media. So students are very interactive and they want to learn. Especially in the final year, I have found students' attitude changes drastically. They want to learn, they want to be better. So this is good for them, I think. We should maintain that. not that COVID, that learning environment. And whether there will be less ragging, I'm looking forward to it, because less student interaction, I don't know. So that's about it. So thank you very much for giving me this opportunity. Thanks.
Right. Thank you, madam. A small question I just want to ask from you, since you mentioned about the library facilities.
Yeah.
Right now, what are the measures that you all have? Can you elaborate on that? What are the measures that you all have taken to lend the books, and once the students return the
Yes.
books, any sort of measures that you all will implement to disinfect
Yes.
or to
Yeah.
prevent the spread of COVID?
Yes, two things. One is the library has established itself a digital repository, digital books. So that is for the use of the students. Those who come physically also, the standard precautions we maintain, like the books are kept, they are not given hand to hand, like. So according to the advice given by the microbiologist, the hand sanitizers will be available. So whenever they handle, they have to clean their hands. And the books which are returned will be kept for some time, and then they can be used. So these are very practical things, like we don't have to go and disinfect or spray anything. Very simple but practical, efficient way where we can stop the viral spread are being practiced. And of course, the sunlight.
Right, thank you, madam. We'll move on to the next speaker. Our next speaker is the Dean of the Faculty of Medicine and Allied Health Sciences, University of Rajarata, Dr. Senaka Pilapitiya. Over to you, sir.
Thank you, Professor Indika and Dr. Sajid, for this opportunity. I also share most of the views of most of the deans that were presented. So what I will do is I will tell the story of Rajarata on establishing or during this COVID-19 period. And so through that, to highlight the opportunities we had, the challenges we faced, and also I think the advances we could make in this online platform. So when the universities were closed, about 3 days after, the head of our medical education unit called me and said, I think we should seriously think of establishing our online platform. Till then, we had only 1 or 2 departments delivering certain contents of their course through the online platform. So I think, so there was a consensus, yes, we should go. And by 18th of March, we formulated a faculty policy and a draft of a kind of a faculty guide to proceed on establishing this online platform in a greater way. And we had a quick discussion with all the heads of the department, and then all agreed. And one of the first things we did was the assessment of the staff readiness for establishing this online teaching platform. So then we identified a few problems, the training needs of the staff and so on. And immediately we started coordinated some CPD activities by our own staff members who are very competent in this field. And we start training the staff. And meanwhile, we also conducted a student readiness survey. And through that, we found the real situation of the students, because we were worried that they might not have adequate access, though we run a good course. And what we found was most of them had internet access, and about 73% said they have good at internet access. It was only about 2 to 3 students for a batch who had real difficulties. So even then we got their addresses, and there was a mechanism to deal with them. And we were having regular discussions with all the batch reps and the union. And one other interesting thing that we found was about 55% of our students were using their mobile phones. So they did not have laptops or tabs. So we had to keep in mind that the quality of at the other end, was on that level. So with the CPD sessions, the staff got ready. And by about 30th March, we were ready to run this the course in a greater way. And we agreed as a faculty that all of the departments will conduct 1 credit for a week of their course content. And all whatever that were doing the theoretical stuff through lectures and tutorials, we agreed upon that each department, depending on the batch their course, that we will conduct it, and that there was a kind of a monitoring mechanism centrally that to see that each department will deliver a content that is equivalent to 1 credit for a week. So we went ahead with this for about 2-3 weeks. And then also at the same time, we decided now one problem with this online platform is that we can teach them, we can deliver certain study material, but the one-to-one interaction is the issue, because when we conduct a tutorial, there will be questions being asked, even the same with the lectures. So one way we thought was we will follow each of these teaching activities with a formative assessment. So actually, if you take from the norm, we won't hold that much of formative assessments after each teaching activity. But one good thing that originated from this was after each teaching activity, there was some form of a formative assessment, so that the students, we assured that they get involved in that. Otherwise, we might be putting it up in the platform and the students might not be really getting the outcome. So there was an increase in the number of formative assessments that we were following, and it was basically after each teaching activity. And at the same time, we created through our LMS a separate CPD portal for the staff to make sure that they keep on improving on their teaching, the skills needed for these online teaching activities. And then at the same time, we also thought that the students in this, following another survey, we identified that some of the students, were not having all these the skills that is there for needed for self-directed learning, plus for a platform, the kind of learning that they should carry on with the online platform. So there was a survey where we looked into, their time management, their the study time, their preferred ways of learning, and the metacognitive skills. So with this assessment, we found that they also do not have the necessary skills. Though we could establish a good platform, some of them lack the skills. So understanding them so we established another CPD for them to understand on self-directed learning. Plus also we introduced them a kind of a self-reflective log. So then we promoted them to keep them. This was this was not a necessity, but we promoted them to maintain this log. And for actually, even at the moment, there are some students who are maintaining, but currently we still don't have an assessment for that, but we have introduced it. So then of course, the modes that we used to deliver our teaching content, we used the standard PowerPoint slides, which were audio recorded. And then there were video recorded lectures. And with the Zoom coming in, we introduced Zoom lectures and Zoom case-based discussion. Particularly the clinical departments established this case-based discussion, because by the time of closure, every department had one appointment was done. So the students have their own case histories. So we got them to present a case history and would discuss in, similar to a ward class. Through the Zoom-based case-based discussion. This was one of the most attractive ways of learning for the students. And of course, again, we held a survey, and I think we had even have sent an abstract to the SLMA for submitted. What we found was students find it as a very promising way of learning, and they really like it. In fact, the staff opinion is slightly differed in that, and actually the students say we really love it, and there were some comments from the staff saying my teaching has vanished in thin air. So that was, there were two different perspectives from the staff and the students, but it went on and it is still continuing as a very effective way of doing the clinical ward classes. And I think the future, what we are thinking is we can follow this similarly even when the students come in. So they can, one student can take a case history, and then of course you can do the same ward class or the case-based discussion using Zoom with the students being at hostels or different places. So then of course we followed these models of teaching, and there were regular evaluations of the effectiveness, of this process. And at one point, after about 8 weeks, we thought that we should also monitor the real student activity. So we evaluated all the logins data for the last 7 weeks, of the first 7 weeks, and so saw that some of the students do not log in frequently enough, so indicating that their intake is not adequate. So what we did was, like, now we have appointed for each department a kind of a temporary lecturer who will be looking into the login data of students for that particular course or the subject on a weekly basis, and will be giving a feedback. And in the faculty board, we came to agreement that we will start an mentoring program for the online training activities, so that now the students are assigned for the teachers, and they will be personally looking into these data and following up with the students. It's a kind of it's a non-threatening, but it's a way of a kind of a promoting the student involvement, and to find out also if any student is their login is less because of a practical issue. Of course, we as the faculty would intervene and try to sort it out. In fact, during these surveys, also during the COVID period, we found about 18 students who were having real financial constraints, and actually there was a support mechanism for that. So similarly, so now the mentoring program is being initiated, where each student will be mentored on this particular, not on other matters, but on the online teaching process. And at the same time, we did after about 10 weeks, we did a survey on their psychological status. We just wanted to know whether if the students are too anxious and whether they have worries and all that. And that also indicated that they have certain anxieties. They are, sometimes, in the previous survey also, we saw that some of the times they do not have a right environment and so on. So we have all that data. So in time, if it is getting extended, we thought we can even offer few students who have real difficulties on continuing these activities, the hostel facilities. So because then, of course, we can provide enough room and so on. So I think getting that data was also very useful for us to provide the future model of training, where all the students will have an equal opportunity to follow this online platform. Otherwise, depending on the resources they have, there might be a variability of them on the usage of this platform. Then the other thing that came is the student, the peer assisted learning. So now this is also one common thing, that when the faculty is on, the students have their own mechanisms of peer assisted learning, and even following a major exam, when they have the repeat, they have those, we all know they call it Kuppi, and they have this peer assisted thing. So we have conducted our second MBBS and have issued the results. And one of the requests when we had the discussions with the student is that now they have no opportunity to do this peer assisted learning. So there was a request from the students, can we use the same LMS platform that, and so we had a very wide discussion on this in the faculty board. And what we thought was, we will create another portal or a course for peer assisted learning, but in this case, it will be a supervised one. So which will, when this peer assisted learning goes on, sometimes you also deliver false facts for students and so on. But so there will be a little bit of supervision, not a full supervision, and we will still create a pathway in the LMS for them to continue with this peer assisted learning. So this is, I think, one new thing that we thought that we will incorporate it for LMS. So these are the few things that we could establish, and I think actually, and we had a weekly assessment of how much of the content we are delivering. And when it comes to theory, except for the practicals and the clinicals, basically every department was delivering about 80 to anything between 80 to 100% of their theoretical content, where we had the limitations of the practical. And now, of course, we have decided on to, like on the previous presentation, some of the practicals are now being done through LMS, but the clinicals, except for case-based discussions, we have not been able to deliver anything other than in the clinical training component. So this is our experience of introducing, and I think the challenges we have is to make sure that our students at the receiving end has the reasonable facilities to access them. Second thing is to get our staff being further trained, and then to get the necessary equipments to, to do it in a better level. And then sometimes we need I think, over the time, even the mindset changed, when we were talking about clinical based discussions with the clinical departments, they said, don't talk about clinical training, how can you replace it, and so on. But as the time went on, there was quite a good response and the involvement from all the clinical departments as well. So the things are changing for the better. And I think as we go on, even when we open up, and we can still adapt some of these practices for a better training and get them transferred to the more technology-based interventions to deliver it. Thank you.
Thank you, Dr. Senakapilapitiya. Again, I think Rajarati is also unique in one way because being in a rural area. So, and also you are drawing students mainly from those regional areas as well. Do you think the students have faced this adverse situation in a resilient way with limited resources?
Yes, I think, yes, from the students' aspect, I think they are, how they have tackled this situation and how they have got adapted is very good. But then, of course, I think they need to be taught on, self-directed learning. That is what from our surveys we found, that it's not, 80% or 90%. There is about 50 to 60% who are doing it well. But then there are about another 40% who are not, do not have the skills of, having their own study plan, checking it, whether they can, whether they are achieving it, and so on. This is particularly towards, junior batches, like the students who have been there for 3-4 years in the faculty are better off in that sense. But the younger ones, I think they need more input from that if you are to be very successful in this.
Thank you. And now let's move into another young university, that's Wayama University. And again, Dr. Sanjeev Bowat, again, I think he's one of the newly appointed deans. Dr. Sanjeev, can you elaborate on what Wayama University has done to face this current situation and also to move forward?
You all.
Good afternoon.
Good afternoon to you all. Thank you for offering this remarkable opportunity to give some idea about the second, possibly the second youngest faculty. Much has been spoken about already, but I would like to address this gathering on 4 lines. I understood that I would like to, I should reiterate after listening to many panelists. And at the same time, I understand that the time has gone wrong way, so I will be very short as well. My first section is about the faculty. This faculty started in 2018. It is only 2 years old. We have only 2 batches, and the university also is relatively young, from 1999, the Wayama University. And we, being very young, we have a handful of academics so far, because the preclinical departments are functioning. We are waiting to hold the second MBBS barrier exam in August most likely after the elections, waiting for the approval from the government as well. Then the clinical training and the paraclinical training will have to be commenced. Those will be tailored according to the events that are taking place in the world, and for which we are slowly preparing. Again, with some hardships of shortage of academic staff and non-academic staff. The card approvals are not happening in a timely manner. For that purpose, I'm really thankful for some of the established universities. They have already expressed their willingness to share their content, academic content. That's a remarkable achievement, remarkable feat by those universities. At the same time, I would like to mention that since we are very young and very few academics are here, I have been vested with the pleasure of informing that we have a large faculty board represented by very senior professors and other professors and senior personalities from most of the universities in Sri Lanka, except a few, mainly Colombo, Javardhanapura, Kelaniya, Peradeniya. There is a large representation covering most of the departments, so that though we are very few in number in the premises permanently, we have a very high eminent group of people advising, preparing and revising the curricula. So in that scenario, we feel we are very well adjusted in that line. So that's a very good beginning. And at the same time, I would like to say beginning of a faculty will be a challenging task. Yes, amidst the challenging nature, we have the hidden benefit that we can establish all these new novel methods and novelty medical education aspects into this curriculum, which we have amply done it already. We are waiting for the UGC approval for the revised curricula. From the subject-based curricula we have moved to more module-based curricula, incorporating most of the novel practices. We have very seriously gone into the global standards given by the World Federation of Medical Education. We have consulted the Sri Lanka qualification framework, and we have taken seriously the SLMA guidelines already available. We have gone into UGC benchmark like that. We have gone into whatever the relevant things. Also, we have gone into Association of American Medical Colleges guidelines in some of these skills related training, like the entrustable professional activities. We have included as far as possible. While saying so, we have included only, we have not seen they are actually happening, because we are yet to see these practices taking place when we start clinical practices. So this is anyway, I believe, is a good beginning, and we had the freedom for a very good beginning, and I'm assuring you that we will take utmost all our efforts to implement them as they appear in our curricula as well. The second segment that I would like to address is what we are doing during this COVID-19 related university closure. It is more or less similar to what the other speakers expressed. Fortunately, we have only 2 batches. Their education has been halted at different semesters. Our biggest challenge is the senior students. They are facing their secondary examination barrier in 1 or 2 months' time. We have planned it for August, for which fortunately we have completed most of the practical related work. So there were only some few modules which could be almost 100% function through the online module, online Moodle associated teaching learning activities. So that was a blessing that we had. The junior students were in their first semester halfway through, so we continued the rest of the semester using most of the techniques that has been already discussed by you. We did not, I wouldn't say we did any remarkable experimental success. We did the same modalities used by others, the Zoom platform, the audio dubbed PowerPoints, a lot of assignments, and some of the practical software such as Aclens for anatomy, like that. We use them, and we did something I would like to mention specifically, that we looked at how successful they are by having a student feedback as well as looking at student participation. I would like to express that our students are participating 100% except on Zoom platform related lectures at the same time. So they couldn't participate at that time. To counter that deficiency, we have instructed, and our academics have done it remarkably, to record them and to make them available for the students to download at easier times when the internet connectivity is better. So in that scenario, I would say we have achieved 100% in reaching all the academic the content, as well as 100% student participation, though they were not on timely manner, but participation is 100%. And at the same time, we had already noted some of the students who were performing poorly at exams. So I have handed over their activities to be supervised by some of the demonstrators, the junior doctors, and they have done a very remarkable follow-up of these activities and have made sure that even the poorly performed students are catching up with the online teaching. So my and our faculty's view is we have achieved a really remarkable online teaching activity up to now, and we can go on with the online teaching for some more time with the junior students, expecting that we are over the entire period of online teaching, our academics have, as far as possible, identified some of the practicals or lectures which needs some revision when the students are physically coming back to university, so that we can offer some sort of a revision for especially for those difficult sections in all three subjects. This may be allowed for the senior students waiting for the second English barrier exam in terms of giving them OSPE-like activities to refresh their some of the practical knowledge. So that's the plan on that line. And I would say the feedback mechanism was really a useful one. Students participated very well on feedback, so that ensured that we were going in the right direction. The amount of work that we gave in the online platform was like 2 to 3 activities a day, and we looked at the experience in the international situation also, which is more or less what we noted is it is almost the same, the workload. Having said that, I'm moving on to my third segment, which is post-COVID restarting. The answer for that is we are following the University Grants Commission regulations of preparedness plan for post-COVID reopening, which we are doing. In fact, all the faculties are doing this, and we have drawn our plans on how to take the students back, how the hostels are to be allocated to students, one room per student, as well as the healthy activities at canteens, how the lecture halls are organized, and how all these are discussed already. We are aiming first for the second MBS examination. The plans are underway, and thereafter our plans are to conduct the online teaching as far as possible, with if the permission allowed, to get the students down for practical work, and while continuing the online education until at a very later time when we can get them down for when they can get them down for physical teaching in lecture halls. And I have learned that the government or the UGC is promoting that we should continue with online teaching even after the corona-related issues are sorted, because it is going to be that's the suggestion, that it should be a long-term activity of teaching learning activity amongst other different activities that we are conducting, for which purpose we have already are in the process of amending our curricula as to giving some 10 to 30% of our lectures should go online hereafter. Then the fourth is the clinical training. That's an issue for any medical faculty. So we also will face this in October-November period. We have 2 hospitals, Kurunagala and Kuliapitiya. There are designation and allocation discussions are going on at ministry, because there should be official announcements. So those are being awaited. There are discussions going on. But anyway, at the beginning, we are a little fortunate that our students are small in number, so that we can divide the students into very small groups, such as 9 per consultant. So in that scenario, we will be able to maintain some physical distancing when we actually start, and we will be starting the training at Kuliapitiya, which is not a very at this minute, it's not largely populated with patients. So anyway, for the initial clinical training, the history-taking examination can be conducted in a less populated ward, which may not hinder their quality of training, but later on we are moving on to more advanced stages of clinical training. We are going to Kurunegala. The Kurunegala and Puliapiti both have very kindly agreed to offer training. So those will be organized, and as an experience that we have received at COVID in COVID pandemic, that the need for skills lab where we can offer clinical and any other training when we cannot visit hospitals. So we have very fortunate enough to receive a AHEAD grant of 75 million very recently, which paved way for us to establish a complete skills training lab. We have done the initial purchasing things, but it will take some time. But anyway, we have secured that fund for a complete virtual lab, including high fidelity mannequins and etc. So that we can utilize maybe even after the hospitals are started, we can some proportion of the training can be done in a lab rather than sending to hospital, which we can decide with expert clinicians later on. So that is about my plan of information that I thought of offering you. Would like to answer any concerns from your side as well. At the end, I'm really thankful again for offering this opportunity to share our situation with all of you. Thank you very much.
Thank you, sir. Those are very valuable points. So we will move on to the next speaker, to the group captain, Dr. Namal Vijay, the Dean, Faculty of Medicine, General Sri John Kotalawala Defence University. Over to you, sir.
Thank you, Arthri and Ajit and Professor Karnatilaka, and also all the fellow deans to giving us the opportunity to share some thoughts and some information. The first thing I want to tell you in a couple of minutes is the difference between the Kotalawala Defence University Medical Faculty and rest of the state medical faculty, because that also involved with the different challenges that we will have to face during to conduct academic activities and clinical training in this new normal situation. As you know, KDU medical faculty is the only non-UGC medical faculty, and this has diverse groups of students. I can divide them into three main groups. They are cadets, and we have a large number of foreign students. We have about 205 foreign students, and also another large group of students absorbed from the previous item medical faculty under a Special Provision Act. Currently, our student strength is
Dr. Namal, can I interrupt you for a moment? Your voice is a little bit low. Can you speak a little bit loud? Then we can hear you.
Yeah, I can speak a bit louder. Currently, the total student strength is 1,000. Can you hear me now?
Yes, sir.
Yeah, okay. 1,240. That includes 270 cadets, 200 foreign students, and 750 students absorbed from the site. And also our training, the cadets also have to undergo military training. That also we have to consider when we organize their training programs. So when we deal with these large number of students and organizing academic activities and clinical training for them, we have to have special plan. The other difference is that because of these large numbers, we have to send our students to so many different hospitals in small groups. At the moment, we are sending our students to 17 different places for clinical training. I'm not going to list all the hospitals that they go in the interest of time, but starting with the University Hospital KDU and several hospitals in the health ministry are given for the training of these students. The other difference is that the students of the KDU are not doing the common exams with the other medical students, and also they are not going in the common merit list. So when we plan our exams, we don't have to follow. However, although we are a non-UGC medical faculty, we are closely following the decisions made by the standing committee of the medical faculties, as well as the programs they run. Because we learn from them, and we also want to follow them. Therefore, we follow closely about what the other medical faculties do. So, with that, next I will move on to the online teaching, which I'm not going to talk much because all the other fellow deans described it I think adequately. And we also, from the first day the lockdown was started, we also followed the online teaching. All the subjects in the curricula were done by the online platform. Only thing is that, although we have completed most of it, my little worry is that the other things like the practicals and some of the practical demonstration have been done, but giving skills to the students, like even in the pre and para clinical department, as well as in the clinical department, skill component and the development, like one of our colleagues mentioned about the extracurricular activities and the peer discussions, as well as even like development of the attitude. Those can't be done in the online platform. So we have to think about it when we plan these programs in the future. However, the online programs are done successfully. But at this juncture, I want to thank the academic staff and the non-academic staff, as well as the medical students, because they all understood the situation and they were agreeing to cope up or adapt with the situation. And without their help, we wouldn't have done what we have done, not only in KDU and also in the other medical faculty. What we did was, while going on with the online programs, we first organized to have our exams. So we knew that the UGC medical faculties the other medical faculties were planning to have the final exams this month. So we also planned to have our exam, the final exam this month. We actually did it. We did the final examination theory component from 1st of June to the 6th of June. It was a challenge because we had 240 students doing the exam. And also this was during the period that the curfew was lifting and again imposing. And after we planned the exam, as you know, on 4th, the island-wide curfew was imposed again. That was on an examination day. So we had to take special precautions in organizing the exam, as well as taking safety precautions. So safety precautions wise, as one dean also suggested, we had to check the temperature at entrance, get them to wash hands, and also we send them a questionnaire asking whether they have had any contact history, whether they are having any symptoms suggestive of a disease condition, and also the halls were arranged at least 2 meters apart, because usually an exam is held anyway 1 meter apart, but here is 2 meters, and that was not difficult because the exam, all the exam halls in the university was available for us. The other students were not coming, and also we had isolated about 5 or 6 rooms, because if anyone of them were having symptoms or suspicions, we had 2 students who had just completed the quarantine period, so they were kept there, and even the staff, the invigilators and supervisors were given personal protective equipment to work there. So likewise, but actually we have successfully held the examination. Out of 240, only 2 students were absent. We still don't know the reason for it, but others were there. One small issue was that we had a lot of foreign students, as I told you before, and some students were in Bhutan. They could not come, and even if they came, they had to undergo the quarantine period. So we had online meetings with them, and we all came to a decision that they will sit in the supplementary exam as their first attempt. So, and also to organize this, we had to organize, if the people needed any lodging, we organized that, and we had a few buses coming from different places to give them transport, and also we initially asked them whether they need any meals. So all those problems that mentioned, we actually practically faced, and they were given packeted meals, and all those were arranged, and we held it successfully. And now they are going to have their clinical exam starting from 7th of July. The difference is that usually we examine about 24 students per subject. Clinicians are here, some of the deans, they all know. But here we are going to have only 16 students, examine only 16 students per day. So the exam will be held over a long period of time. However, we are planning to do that. And as a result, we also had to allow them to go to the wards. So these students had not gone to wards since February. So now, unofficially, because it's not official clinical training program, because they have to practice for their clinical examination, they are going. So what we have done is to allow up to 10 students to go at a time. We have divided the ward into 3 shifts from 8 to 12, 1 to 5, and 6 to 10, and 4 wards in 4. So we can easily do that, and we monitor that whether it happens. And also at the moment we are using both University Hospital KDU and Neville Fernandez Hospital for this purpose. So that is with the final exam, but we also have planned to do the second MBBS exam starting from 24th of August. And next month we are going to do the part 1 exam, third MBBS part 1. And in September, the third MBBS part 2. And in October, the supplementary exam of the final MBBS. And with regards to the clinical training program, we are actually following what happens in other medical faculties, as well as how the authorization is given by the health ministry with regards to sending students to the health ministry hospital for clinical training. That we are following. For the next professorial, for the next batch, we will not be able to start until the beginning of August, because this exam that we are conducting is finishing. So the hospitals will be out of bound. The University Hospital KDU and the Neville Fernandez Hospital will be out of bound for hospitals, so we will not be able to. But the other clinical training commencement will be depending on the authorizations given by the health ministry and the other relevant authorities for the clinical training. Now, in the future, we will have to change a little bit. Because when the students go, as mentioned before, the student numbers have to be smaller, and also the ward situation, the facilities have to be changed, because as you know, most of the wards in the health institute hospitals are overcrowded, and there are a lot of staff, the bystanders, the patients, the staff members, they all are working in a very small environment, and when students also go there, they further increase the density inside the ward. Therefore, the separate places for them to have ward classes and all these things need to be arranged. And also, the skills lab and a simulation center is very important. In KDU, we have an excellent skills lab, and we have sim man. We can program them to give different clinical scenarios. We can use them for clinical training, and simulation can be done when one person examines a patient, others can watch. So likewise, there are a lot of different ways of conducting clinical teaching. We are also looking at them, and also we are prepared to learn from what other medical faculties do. Having said that, as I told you at the beginning, there are a lot of students. Like at the moment, we have 823 students needing clinical training once the university is started again. But we are looking into it, and because we have done this before also to these large numbers of students, and we will do it the best possible way, but taking all the precautions for the safety of students. And last thing, as we discussed, this is also a good opportunity for the students to go for clinical training and do their training in a different situation, because they can learn then how to take these precautions, how to wear these protective equipment, and how to be, take safety precautions and do their clinical activities. When they become doctors, they can use those skills that they acquire during this training. Okay, I will not talk any further because time is up, and I can answer any questions if you want. Thank you very much again.
Thank you, Professor Naval Vijay Singh, and thank you for highlighting how you are going to arrange the clinical examination, because that would be another challenge that we'll be facing. Because of the interest of time, we'll be moving into the next presentation. After that, we'll be making few comments again from the deans. And the next presentation is from Professor K.D. Patirana, who is a professor in medicine. He's representing the Faculty of Medicine, University of Ruhuna.
Yeah, good afternoon. Thank you, Indika and Sajid. I'm representing the Dean, Faculty of Medicine, who is in a different meeting today. First of all, I would tell what we did during this, when the epidemic is on and the country is closed down. I asked the MENSTU head, I spoke to the Dean and discussed this. Of course, he agreed. And then the next question asked by the most of the staff members was whether we are giving equal opportunities for all the students. Well, while doing, we used the LMS and uploaded our lectures, and then of course some of us have already started Zoom lectures. In the meantime, we quickly surveyed through the batch steps. We surveyed the availability and accessibility of the technology for the students, and actually it was very good. And there were only about 4 students who, 4 or 5 students who did not have a smartphone, unfortunately. But I have seen many have suggested how to support the students. In fact, trade union RFMTA volunteered to supply smartphones for those who did not have smartphones. Regarding the accessibility, the dean spoke to the service providers, but still there were 2 or 3 students who did not have a good online access. But then we recorded the Zoom lectures and uploaded them into the LMS. So what we have done there is roughly the same like most of the other faculties have done. And in addition to lectures, we conducted some small group discussions through breakout rooms, and there was a very good acceptability by the students. And in fact, regarding the lectures, the attendance was very good. Many were online. Of course, there were some technical problems again where students could not be. They were in the waiting room, but more or less their participation was very good. And the number of questions asked, all of the teachers have said the number of questions I've asked is much more than in a normal lecture. Well, there is a plus and a minus point of it, because it is because they are sort of they are suppressed, or they are little reluctant to ask questions in a lecture where the others are there. So that indicates another aspect, because online lectures alone may not be adequate to improve their other skills, and that we are planning to address. And clinical departments did many case-based discussions, problem-based discussions, where again, the other advantage is when we are doing a group discussion with the batch, generally only one group, maybe maximum 20 to 40 students may be joining the normal class. But here, virtually the full batch can join in the group discussion or the case-based discussion, so that we felt as an advantage. And we used e-library, and we always send them the link for the textbooks to be read with the pages. Many have received the link, but only few have were ready when we tested that. The other aspect is once we have started Zoom lectures, the other teachers who are not really in the faculty but extended faculty teachers have started Zoom from their private links, so that about 100 students directly joined, and to various other means most of the students joined. Especially they were discussing questions and difficult scenarios and MCQs and so forth. Luckily, we had a fairly good infrastructure, although that was not sufficient at times, especially the internet speeds. So other important thing that we have noticed is earlier when we were introducing LMS, like somebody else also mentioned, people a bit reluctant. They were thinking of copyrights, the lectures will be copied, and many concerns when we asked them to upload their lectures into the LMS. But soon after this problem occurs, nearly everybody agreed that this is a very good way and this need to be continued. Of course, there are many ways that the teachers join the Zoom or the Zoom lectures, because at times when there are many lectures going on in the faculty, some teachers has to go back to home and start lectures, but subsequently they were all sorted out, and we have planned to upgrade the system so that we can do them from the faculty. Regarding the number of lectures to go, and as I said, for content delivery, Zoom is a very good platform, and even for discussions, the case-based discussions, small group discussions, many things can be done. But as we have found in these lectures, when they ask more questions during the online lectures than one-to-one lectures. So what we felt is that those skills, the skills of communication, skills of team working, leadership, those things cannot be done through Zoom. So I think part of the lecture, we felt that what proportionate should be online and what proportionate should be real was discussed, and there is no consensus, but we thought it should never be more than 50%. But some people said it's 30%, but should never be more than 50%. And we again felt that the students, there should be a way to check whether the students can just be online and do nothing. And being a father of 3 children, I know sometimes what they do with online lectures. So what we felt is that at each lecture, as again somebody mentioned, that it's better to give some formative assessment, either MCQs or discussion to answer. And we always give our official email address to them, and they send us answers. And again, we have done many surveys of their participation as well as evaluation of the lectures. So there is a very good feedback. There are several concerns. Although many students said this is a good platform, one or two has said, especially during these small group breakthrough rooms, they said some students dominate. But we were, and that to go back to sort of a lecture type of a teaching. But when we checked the authenticity of these email addresses, we found that they were not really coming from the students. So I don't know what has happened there. One or two has said the small group discussions are dominated by one or two participants, which I have not noticed myself. And of course, you can go into the online discussion room and see what they are discussing. Most of the time they are discussing the stuff, or with occasional deviations. Teachers have been very positive, but one or two departments felt that, again, because of the concerns regarding the equal opportunities thing, they will only use the LMS platform. Regarding the clinical teaching, and we all agreed, most of us agreed that although we can have some case discussions, clinical teaching per se cannot be done through this media. And we have discussed in our departments to some extent how we are going to do this when the country reopens. Probably we will not entertain the same number of students in the ward. We will be maybe dividing them into 3 or 4 and doing different activities rather than all gathering at the same place. And we are trying to use the morning and afternoon sessions for the final year batch because they have finished all their lectures. So they are free throughout the day. So we will be having 2 sessions with half number of students. That's one suggestion. And the discussions probably be done at a different place than the hospital. Probably they may be taking the history and discussing in a larger teaching area in the faculty. So those are the things. And as all the other faculties, we also have we are planning to conduct the final year examination, the theory, and the clinicals. Of course, luckily we have completed it before theory, so that that problem may not be for us. And even in that case, what we were planning is, again, as the Dean KDU mentioned, to have smaller numbers per day, of course, making it a long examination in case COVID problem persists till the next exam, because currently we have finished our clinicals. So all the other measures like hand washing and social distancing we have followed, and then we have all following the government instructions. So finally, I must say that although this is a very good platform, the equal opportunity status should be respected. And as many have mentioned here, we have to have some system where all the students have the access, not only for the LMS, but for the Zoom lecture as well, online, direct. And when we have to have new ways of doing practicals, clinicals we mentioned, but the other important aspects like communication and interpersonal skills and leadership skills, that type of things, I think we still need to have the traditional way of small groups with some social distancing, and in teamwork and interpersonal skills, I don't know how to maintain the social distancing and having effective training, right? Okay, thank you very much.
Thank you, Professor Kitsiri Pathirana. And now we have heard from all the faculties, and it's really wonderful to listen to what the faculties have taken under these very challenging circumstances and the wonderful work that they have been doing. And there are a lot of commonalities that all the faculties have taken up this challenge, and a lot of innovative activities have taken place. And they have discussed how the faculty has taken up this challenge and the students, and how they have face it positively and enjoy the teaching and the learning. That was a very positive kind of outcome. And then the challenges really related to the facilities, resources, and also ensuring equity, how to provide the facilities for everyone, and the challenges related to clinical teaching, assessment. So many areas were discussed. Maybe before concluding, we'll go through one round with our resource persons with one short comment related to those areas that we have discussed. We can, you can come in any sequence, whoever who want to come first, and maybe with one short comment related to the areas that we have discussed previously. And we don't have much time remaining. Anyhow, if there are any other burning questions, you can raise your hands and we might be able to give the opportunity. Shall we go another round with our panelists before concluding? Any of the panelists can come.
Indika, may I start then? Yeah. So I think, as I said at the beginning, I think all of us are in this together, and we are all facing the same challenges, the same issues, and there is an opportunity for all of us to learn from each other, and doing that collaboratively, going forward collaboratively, I think is the way to success. So as I said at the very beginning, we look forward to collaborating with everyone, and I hope as we go along, we will also be able to take our standard of our medical education to a different level, and also this will be the opportunity for us to integrate technology, both educational technology as well as other technologies into our medical school. So we should make use of this opportunity. So that's my concluding remark. Thank you very much.
Thank you, and yeah, so what about the other panelists? You can come out with very short comments based on.
Yes, Professor Indika, can I come in?
Yes, please.
Yeah. No, I think up to now in Sri Lanka, our state medical faculties have been training very skillful doctors who are very good in their clinical skills. So I think our main challenge is the theory and to some extent the paraclinical practicals and things. Maybe this is a very good, the web-based mode is very good. But I think our challenge is to really think of how we are going to maintain the clinical skills and the good attitudes among our medical students in clinical teaching. Because finally, as a house officer, they should be very skillful in treating patients. Humane, the empathy, all those things, I think we have to pay real attention in training the students in those modes. So with that concluding remark, I think I would like to make as medical educators, we all, the deans, I think we have to pay extreme attention in how we are going to maintain the clinical skills training for the students. Thank you.
Thank you, and I think that's very important because the minimum standards also come into play. So how we can reach those minimum standards within the current constraints, but without compromising on the clinical training. So that would be the main challenge that we are having. Yes, and shall we move into the other panelists that we are having? Dr. Angela, you want to come? Or Dr. Amal? Yes, come.
Yeah, first of all, I must thank you, Professor Indika, for organizing this very important meeting. Because it's very good for all of us to discuss this important matter. I think after listening to everyone, the teaching in the pre-clinical and the paraclinical subjects are going on relatively smoothly, although the practicals and those sort of things need to be done further. However, the clinical training is the area that we have to put a lot of attention into. I also believe as a clinician that the most important component of the academic program of a medical student is their clinical training. And in a country like this, where we have a lot of clinical material, we have to make use of them and improve the skills, clinical skills of our students and make them good house officers and good doctors. So we have to find different ways in this new normal scenario to do this. One small suggestion is to go away from try and go away from the traditional teaching hospital to peripheral hospitals also, where there are good material and also good clinicians. Now all the peripheral hospitals have board certified consultants, so make use of them and send small groups of students to do their clinical training. Thank you very much.
Thank you, sir.
Thank you, Dr. Ramal. Yes, I think again, you highlighted the need for clinical training and maximizing the uses of resources available. Probably the role of technology is to identify how to deliver and not to compromise the clinical material that is available to us. I think Dr. Asri Abegunwardhan, he has to leave early, but he also wants to convey the same message using the technology to deliver the clinical teaching without compromising. Then the other panelists, your final comments?
Well, I'm Professor Nirmali Vikramaratna. I like to take this opportunity to tell that with this experience that we are having today, going online teaching, and this we can take as opportunity, and now we can actually, by facilitating the online teaching, we can get the expertise knowledge from other universities, well-established universities, professors, to address the areas that we dearth of. So there are areas that we cannot find professors in those particular fields. So if we can get the expertise knowledge from those, so here we can, from the beginning, start addressing the maintaining the standards of the medical education.
Yes, I would like to add, Professor Indika, that this is a good opportunity to develop the self-directed learning in students. So our staff also must be guided how to guide the students in self-directed learning, and about using the peripheral hospitals also. Yeah. So even though they are very good clinicians, I think time to time we have to update their knowledge in clinical training, how to deal with the students and what need to be said to them. Right? Sometimes they go out and they come with the students are not treated well, or they are looked down upon. So therefore, I think sort of a training or a capacity building for all clinicians to be should be done time to time regarding medical students teaching.
Thank you, madam. Dr. Pathirana?
Yeah, what I want to stress is, although this is a very good platform and we can do content teaching here, but we should never forget that major part of our training is in clinical training, and not only the clinical examination and the cases, but the other soft skills. So I think as soon as this has come to normalcy, now we are in a new normal, but when we come to normalcy, we should, well, while continuing the good aspect of this, we should restart our teaching with the students' clinical teaching and the classroom teaching, because that gives the different other aspects of teaching learning, and especially there is a hidden curriculum, like in a small group discussion, the students will learn many other things other than what's stipulated in the curriculum. So my request is to, well, not completely forget the good aspect of the traditional teaching when we restart. Okay.
Thank you, sir. Any other comments by Dr. Pilapitia or Dr. Bovatne?
Yeah,
Dr.
I will
Pilapitia.
agree with the majority, and what I want to also say, the strength of our graduates in this country is the clinical training. And so far, whatever the modalities we have used in online platform do not replace any of the, they do not reach the same level of the kind of clinical training we offer and the skills and the soft skills that the students acquire. So by no means this will be a replacement for that. But I would like to join with the Dean of the Colombo Medical Faculty, who initially in his speech said we should advance and incorporate the technology for more advanced things where we might be able to reach some, to use them for in place of the clinical training to a certain limit, but never in total. So we have to be very careful and venture very carefully in this region to make sure that our graduates will never be deprived of the kind of clinical training they were receiving.
Thank you, sir. Dr. Bowatta or Professor Asiri, any other final comments? Professor Vijay Singh? Since there are no other comments, I would like to hand over to Professor Indika to carry on the session.
Thank you, Sajid. And with that, we come to the end of this very useful, very productive session. And I think I would say a historic session. And where all the deans coming together and sharing the experiences of this new situation and how to move towards the new norm. And we have listened to all this important information. We share the information. And let's move from here onwards. Identify what are the areas that we need to move. And then the way forward. This session will be available online for all of you to share, and will be summarizing the findings and then conveying to the necessary decision makers, including the Ministry of Higher Education as well as the UGC and all the faculties, so that we can make use of the discussion, this very valuable and important discussion. With that, I thank all of you, everyone who supported to organize this first pre-conference workshop, our technical team from SLMA, including Pramod and Sajid and everyone from SLMA, and all the deans who, in spite of their very busy schedules, who spend very valuable time with all of us and sharing valuable information which we cannot get from anywhere else. So thank you for all of you and our participants, the academics and the lecturers and all other participants. Thank you very much for remaining with us, and have a nice day. Thank you.
Thank you.